The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to the state's response to COVID-19 in childcare, part 4. We're so glad to have all of you joining us today. My name is Kiami Harris. I am the Director of Learning and Events here at Childcare Aware of America. And just wanted to go over a couple of housekeeping things with you. First, we are going to have questions and answers at the end of the session, and so we invite you to put all of your questions in the questions box that you'll see on your screen, and we'll try to take as many as we can. Of course, we may not get to them all, and we will try to get you answers to some of your questions if we don't get to them in a later email. This session is being recorded, and we will share it out to you in an email, as well as share the slides. And I know that question is going to come up again, and so we will chat that to you all just so you are aware that, again, it is being recorded. So today we have quite the dynamic presenters for you all. We've asked each week we try to ask presenters who are from states to share the great works that are happening in their states around their response to COVID-19 and as it relates to child care. So this week we have asked Oregon and California to join us. And so I'm going to do a quick introduction of the presenters and turn it over because they have a lot of material to share with you. So we have first Joan Blau, who is a social worker and has spent her 30-year career creating innovative family-centered programs and building comprehensive systems to improve outcomes for young children and their families. Her experience cuts across the fields of pediatric and behavioral health, early intervention, child care.
To enable audio controls, please enter your audio PIN followed by the pound or hash sign.
Sorry about that. She's done work in child care, parent and family leadership, and early learning. Ms. Blau currently serves as the Community Systems Director of the Oregon Division of Early Learning. She is going to be joined by Robin Lopez Melton, who is a director of the Center on Early Learning at the Research Institute at Western Oregon University, where she directs SPARK, Oregon's Quality Rating and Improvement System, and the state coordination of Oregon's Child Care Resource and Referral. Before her current position, Robin worked as the Latino Outreach Coordinator at the nonprofit Child Abuse Prevention Program, working with at-risk families with children 0 to 3. Robin's 15-year career also includes experience at local child care resource and referral agencies where she served as a bilingual parent and provider specialist. Also joining us is Linda Asato from California, and she brings 20 years of successful public sector nonprofit management experience and a lifetime commitment to child and family advocacy. She understands the dynamic early childhood environment and has extensive experience in community organizing, public administration, and organizational development. As the executive director, Linda is at the forefront of leading the network in its mission to inspire, inform, and advocate for quality childcare systems that support all families in California. Prior to joining the network, Linda served as the executive director of Wu Yi Children's Services in San Francisco. Joining her is Kim McDougall. Kim is the executive director of YMCA's Child Care Resource Service Department. Kim previously held the position of executive manager at Child Care Resource Service Department in the San Diego YMCA and has been a driving force behind many innovative initiatives that expand the impact in their community. I'm going to turn it over to Joan and Robin.
Thank you. Are you going to be moving to our first slide? I'm sorry, I can't see the slides.
I can't either.
Are you able to hear me?
Yes, I can hear you.
Okay, I'm wondering, are you going to move the slides?
Yep, the slide is moving.
Oh, well, I can't.
Kiami, it's not showing on our end. It's
Okay.
stuck on your introduction slide.
Oh, okay. I was
Great. Well, good afternoon, everyone. Thank you again for joining us today. We welcome the opportunity to talk about the important work that we're doing in Oregon to support children, families, and providers during COVID-19. On March 23rd, the executive order from Governor Brown closed childcare, and that required us to establish essentially what emergency childcare would be in the state of Oregon. And any childcare program that wasn't willing to operate in accordance with the temporary order for emergency childcare needed to close, and those childcare that were interested in operating as emergency childcare needed to apply to become emergency childcare. So currently we have about 2,100 of our normal, almost 3,900 childcare open and operating as emergency childcare. This means that we have current capacity that is not being used of about 22,000 childcare spaces. We have current capacity of about 22,000 spaces, and we have about 7,400 vacancies in those spaces. We allowed various types of emergency childcare, licensed childcare programs, of course. We also had initial direction in our state because, like all of you, are sort of learning as we went and believed that we might need some additional capacity. So while schools were closed in Oregon, the governor did direct schools to explore the possibility of being able to open to provide emergency childcare, especially to essential workers. And so we did and do have some schools open providing emergency childcare. We also thought we just simply didn't really know what our landscape would look like. So we also did offer the possibility for programs like YMCA that typically might only operate at one site to open what we called pop-up sites with some slightly reduced expectations in terms of inspections and things like that, so that we'd be able to offer enough care for first responders and essential personnel. Just yesterday, the governor issued what is considered reopening guidance for the childcare sector in Oregon. We're at the beginning of our phased reopening, and this most recent guidance continues to prioritize children of essential workers, but it is also now going to allow families who are going to be returning to work in the different sectors over the phased reopening to have access to childcare. We are continuing to prioritize stable groups of 10 children. There are going to be now some allowances for part-time differences, but essentially it still means that overall, childcare family homes of both sizes and center classrooms will still be limited to 10 children in a stable group. Of course, we have increased health and safety guidelines, and we've worked very closely with the Oregon Health Authority in the development and modification of those guidelines as we've learned more during the pandemic. And we are going to be requiring the keeping of daily attendance logs to help to support contact tracing if that should become necessary. You can go to the next slide. One of the things that I think has been a hallmark of our response by the Early Learning Division, which includes the Office of Child Care in Oregon, is how much we've really reached out and engaged with the provider community in a variety of ways. And as we were approaching the phased reopening, the governor's office asked us to field a survey to child care providers so that we could gain their perspectives to help to inform what the phased reopening might look like and the guidance to the child care sector would look like. Based on, we had about 1,200 responses to this survey. And as you can see, the biggest barrier by quite a large margin to perceived reopening by child care providers was the health and safety concerns. And the way the question was phrased was, it was about themselves, their staff, and the children and families that they serve. So we really use this information, which we'll be talking more about in a minute, to help to inform how we're thinking about the reopening and how we've actually decided to allocate some of our CARES grant funding and the other funding that we've had available to us to help to support childcare to operate as emergency childcare, and also to anticipate the need to support childcare to reopen as our phased reopening proceeds. Next slide. In addition to keeping emergency childcare opening, we have at the Early Learning Division also really focused on sustaining services to children and families. And there's a few things that I'd like to mention associated with that. One is that we have a statewide system of healthy families in Oregon, and we know how important that program is to families who are experiencing a lot of difficulties in their communities, loss of job, etc. So we've been able to stand up remote home visitation services to families through Healthy Families Oregon, and a number of the other home visitation programs in Oregon are also providing remote services. Our Oregon pre-kindergarten Head Start, so this is our state-funded Head Start program, is continuing to provide family services, and all staff are being maintained as employed. This has been crucially important in helping to make sure that families have access to food and also to essential supplies like diapers and formula for families that would normally, children would normally be receiving that through their participation in Early Head Start. Our Preschool Promise programs, which is our state-funded, another one of our state-funded pre-K programs, we've been able to maintain their support for them, and many of them are anticipating be able to provide additional services to families and hopefully to have a reopening in the fall. And then another thing that we've been able to do is to purchase full classrooms that are available for mobilization, and we've been able to prioritize the use of those for spaces that needed to be open for children that didn't necessarily have a classroom set up. And then I'm going to turn it over here to talk about this other part of the slide to Robin, who talk a little bit about the work that Western Oregon University partnered with the Early Learning Division on in helping us to create a substitute pool.
Thanks, Joan. Yes, another part of the emergency response that we started really right away, we thought as a response to a pre-response to a need that we saw coming, was creating a substitute pool. We had not had a substitute pool in Oregon for many years, and we knew that we probably would need one through this crisis. And so we were able to reach out through our the Oregon Registry, our professional development registry, and get information on everyone who sort of the workforce. And we were able to send out information to those folks, giving them the opportunity to sign up to be a substitute pool. We knew many of them had just been laid off from their jobs. And we have now about 600 approved participants. They have to have the basic trainings necessary and a background check. And now we are actually using NACRAWare to provide referrals to child care programs looking for substitutes or emergency workers. It also turned into another partnership where we were able to partner with the Department of Human Services youth shelters and group home facilities and provide referrals to those places who are needing staff right now. And we're working towards a partnership also for child welfare programs, being able to use the sub list as well. There's also conversations just about if we've built this up, is this something that we can sustain past the emergency, because providers are finding it very useful to be able to call and get a list of qualified workers to come and work in their programs. Unless Joan has something else on that, we can go to next slide.
Hi, I'm going to talk a little bit about our emergency supplies. This is another example of how we turn to our child care providers in Oregon first to ask them very quickly after the emergency was declared what kind of supplies and resources would be helpful to them, being able to remain open. We took the results of those surveys and went to our essentially our emergency command in Oregon, which is a coordinated effort that brings together all of the state agencies. And we were able to use emergency state funds, which we anticipate being reimbursed by FEMA for, of about $4 million to procure emergency supplies. This has just been an incredible effort that you can see on this slide. It's brought together our Department of Administrative Services, our Sheriff's Association, which I'll talk about in a minute. The National Guard has been integral to helping us be able to essentially, we've had a warehouse full of supplies, and they've been essential to us being able to move those supplies, package them. We also have had the Oregon Military Department's been involved, and the Research Institute, which is where Robin is from, and then local CCR&R. So beginning on within 3 weeks of March 13th, we were able to open up supplies ordering. We've been able to set it up that providers can go online. They can see the supplies that are available at any given time. They can place an order, and the deliveries are actually shipped right to their residence, except for bleach, which I'll talk about in a minute. Our first orders were shipped on April 8th, and we have, to date, we've delivered nearly 3,000 orders. We anticipate we'll be winding down this effort in the next couple of weeks, the way it's working right now, because the National Guard is leaving, and they've just been such an integral support. So we're investigating other options. And I'll just say a little bit about bleach. We've really had difficulty across the state of Oregon with providers getting access to cleaning supplies and sanitation supplies. And in particular, bleach has been a problem. And so it took us a while to figure it out, but we eventually were able to actually partner with the Sheriff's Association in Oregon, because bleach needed to be delivered in a special way. And essentially, we have had sheriffs across the state of Oregon bringing bleach to childcare provider settings, 2 gallons at a time, and handing it to the provider. And of course, we let everybody know that this was going to happen, and the sheriff calls ahead and lets the provider know that he's coming. And so we've delivered about almost 600 deliveries of bleach. And I think we've really made a significant difference in terms of being able to literally meet providers where they are and to bring them the supplies that they need. And if you saw some of the terrific pictures from this, you'd see that it's been pretty much a win-win for both the folks who get to feel like they're making a difference here in a really positive way, and also for the providers to feel supported by their community. Next slide, please. Just a few brief comments here on our CARES Act funding. We're in phase 1 of this funding right now. As you can see, our application deadline actually closed on Monday for our first round of emergency grants. These grants are available, were made available to providers that were open to provide emergency child care. And it's a payment that will occur 3 times. They'll get an initial upfront payment, and if they stay open, they'll get subsequent payments. We've also been working very closely with our Department of Human Services, with whom we contract to provide employment-related daycare, child care subsidy in Oregon, and we've been able to make some temporary policy changes. So right now we don't have any parent co-pays. We've got it's easier for families to become eligible. We're at 85% of median income or 250% of poverty. Programs that close are able to continue to bill for subsidy, and programs that have a child that's absent can bill for up to 1 month. So it's not clear to us exactly how long those benefit enhancements will be able to continue, because of course, like I'm sure other states are starting to experience the implications of what this emergency is going to mean for their state budgets. We are still in the process of determining what's going to be happening with the rest of this initial CARES Act funding. And then we need to go to the next slide.
I will take this one. So just a little bit about how the CCR&R system has been mobilized statewide to support the efforts of the Early Learning Division and make sure that all the providers in their areas are receiving information and the support that they need. So central coordination, where we are, we were actually given an emergency contract by the ELD to make sure that we could mobilize and support with all of the work that was needed. Part of that has been translation. One of the excellent focuses, I think, in Oregon is really on making sure that information can get out to all of the providers and always using the equity lens. And we have multiple bilingual staff that are able to provide very quick turnaround translation support. Oftentimes we use a company, but this extra contract was able to buy out that time so that we could turn translation around in multiple languages in just less than 1 business day. There's been increased communication across the whole system. The ELD has been meeting weekly at least with the full statewide system of CCR&R and daily with us to make sure that work is happening. There have been many, many changes to the state child care database to make sure that we're able to track and provide accurate information on vacancies, on emergency child cares, open, on temporary closures, on all of those pieces, and data is provided daily that's been used to make decisions about phasing and reopening and those pieces. 211, who does our referrals statewide, they have been able to provide enhanced referrals for any emergency child care worker. So they're making sure that they're following back up with those family members looking for child care and ensuring that they're finding child care in their community that works, emergency child care. CCR&Rs are calling providers and doing many, many vacancy checks with providers to make sure that the database is up to date so that parents can get accurate referrals and the state can get accurate counts on vacancies and make decisions based on that. And we were also able to to start a helpline. And I was just looking at the data, and in the first about month and a half of the COVID emergency, we received over 1,000 phone calls on that helpline because people are looking for information and answers, and they were able to get to a line that's open, and people are answering it and get those information, that information. I don't think I missed anything on this. So I believe that's the end of our presentation, unless Joan has something to add, and we can toss it over to California.
That sounds great.
Great. So my name is Linda Sato, and I'm from California. I'm the executive director of the state network here. Also joining me on this presentation is Kim McDougall, and she's a member of the network, but runs a large resource and referral program in San Diego County, which is one of California's large counties as well. So to start, first I want to say is thank you all for both your interest and the work that I know that you are doing. R&Rs across the nation are really critical in this time, and hopefully you could see that both from Oregon, and you'll hear that a little bit from our work as well in California. So to start, you could see here that March 4th was when the governor declared a state of emergency for California as a threat, from a threat of COVID-19. And that set forth a chain of events and activities. So immediately after that state of emergency, a lot of the state departments started organizing themselves, and the operations centers started, getting into action. And during this time, the R&Rs particularly start working with childcare licensing. So that's some of the work that we started doing immediately after. So that was on the operations of childcare facilities. We were hearing about the need for emergency temporary childcare or pop-ups, if you will. We're working with them around fingerprinting, and so that the first directive that comes out on childcare is on March 16th by licensing on these issues. But more interestingly, I guess, is I'll tell you that are on these slides, is that on March 17, the Governor Newsom signs 2 bills into law, and they have some important ECE touch points. So the first is SB 89, which appropriates up to $1 billion from the general fund for purposes related to the state of emergency. So in that, it calls out the cleaning of childcare facilities so that they're able to remain open as a priority, and just as we've heard about the importance of the cleaning supplies. And we were hearing that too, right after the state of emergency, as everybody is trying to get in line to shelter in place and stock up on stuff. The quickness of that prevented some of the providers to be able to get those supplies themselves as they remained open. And so certainly this was a early identified need, which I'll talk about a little bit later. So the second bill, SB 117, it provides statutory changes needed to implement the governor's executive order on education. So among the several provisions, the bill waived attendance and reporting requirements related to the payment of subsidized childcare. And really the whole point here is to ensure continuity of payment to keep these businesses open. So programs are reimbursed using the most recent available records or invoices, so that on a short-term basis, they're held harmless for any COVID-19 related closures or drops in attendance. And for center-based contractors, or we have these family childcare networks that are associated with center-based contracts, that they are also held harmless, extended through June 30th, 2020. For family childcare homes and other programs that are receiving subsidies through our voucher program, we call that alternative payment vouchers, they're held harmless for only up to 30 days after they're closed. So you could imagine that, you know, some of these programs that were closed in end of March or early April, that they're no longer paid unless they're reopened. This is, again, this is happening in March. By March 19, the governor has a stay-at-home order for all Californians except for essential workers. So this is where stuff is really ramping up for all of us. So next slide, please. So, so in addition to those two orders that I just talked about, April 14th, Governor Newsom signed an executive order to provide expanded access to childcare for essential workers as part of the COVID-19 response. And he appropriates $50 million to support limited-term additional childcare spaces. And so these funds go to the voucher management agencies, many of them, most of them, who are also in our resource and referral agencies. So again, just highlighting the importance of our agencies and their work in this. So the order allows California Department of Education and our Department of Social Services the flexibility to waive certain programmatic and administrative requirements. These waivers focus on eligibility and enrollment priorities that had, under normal circumstances, would have prevented some of the programs for serving children of essential workers. So now it does prioritize essential workers, and the priorities are for use of these funds is at-risk population. So that's child protective services, foster care, or risk of abuse and neglect, or if they're an essential worker family, or if they're disabled or special needs families. So, so now again, it broadens this, so it does have healthcare professionals, emergency response workers, law enforcement, grocery workers, just the entire at-risk population in this. And guidance was also provided on this on group size during this time. And so basically what I'm trying to say also is that with that $50 million, we know that the need is much greater, and that this was allocated for and estimated to about 20,000 children over the course of just those 2 months or through June. I should also say, as while this influx of dollars to serve all these essential workers is taking place, that you could imagine that finding childcare was also elevated. And I must say, this is where I think R&Rs, resource and referral agencies, were sort of taken for granted. We were kind of an autopilot. You know, referrals was on autopilot in a lot of the state's mind, that this sort of just happens. But when you have this huge elevated need, it also elevated the need to have a system that could more easily support and place and help families find the childcare they need. So, so I should say also the R&Rs at this time are also considered essential workers, and there was a directive on that, so they had to be open and they should be serving people during this time. But just in terms of finding the childcare, so in California we're very localized, and so we didn't have a statewide searchable system. And so a couple of systems did bubble up. One of those was possibly using what the unions had developed. They have an app for their membership. Also, the state realized that because the R&R's data was not at this point consolidated into one, that they created their own website, and it just highlighted a flaw of neglect on the state's part in the R&Rs, and so they were thinking that they would use the licensing database to try to create a statewide search function, and now we've been an integral part of that. While that statewide website and search function has been launched already, the R&Rs are the back end of that data, because they're the ones that that identify the vacancies, and soon that will evolve from the state's COVID-19 site to become ours and launch as we launch our statewide search function. So I just think it was interesting that you know, it wasn't until this crisis that we've been really recognized for that particular role and the importance of that role for everybody. So the next slide, please. So as I was saying earlier, that we identified very early the need for childcare cleaning and sanitation supplies and services that were needed. So you know, and the R&Rs very quickly and just amazingly did a massive survey effort in late March to assess the needs for a 60-day period, because at that time we didn't know how long we were going to be closed, or that facilities would be closed, and that each of the R&Rs, in partnership with their local childcare partners, were able to assess the needs, and in particular some of the major things that you could imagine of the cleaning supplies, you know, hand sanitizers, diapers, wipes, formula, just a range of supplies that were identified, and we use that to do some advocacy. So one of those is, as I was saying earlier, about SB 89, which was that state funds for emergency purposes. We went through a process of trying to access some of those dollars through our local emergency operations. R&Rs also at this time were looking at their existing state contracts and looking for waivers so they could support the providers. And we used all these different efforts, the surveys, to try to get state and local funds. We were using our own contracted money, and we were just going through the legislature and really trying to get some help here for the providers. So there were a couple of investments that were happening at this time. The state, we have through our tobacco funds, is an entity called the First Five. They're one in every county, but there's also state operations in that. They were able to approve $4 million for diapers, wipes, and soap. And so that was one fast way we can get some dollars. The other fast way that was the waivers, as I spoke about, and some of those funds have been expended and supplies have gone out. But the big one is the state was then able to put forth $50 million to go through local R&Rs to reimburse childcare providers for purchases that relate to sanitation or services, as well as for the R&Rs, if they choose to also be able to provide supplies for the providers. So right now, those funds have been distributed to the R&Rs. They're in the process of figuring out and giving that option to any provider that's open or plans to open, whether they need to be reimbursed for some of these purchases, or whether the R&R has a capacity to access supplies and to distribute those. So that has been a major effort that's currently going on. We continue to have weekly webinars with all our members and our state partners, Let's Licensing, folks that are working on this statewide website and childcare search, as well as our Department of Education partners as well. And that's been just to keep the communication going with the field and with them. I just want to say a little bit about advocacy before I turn this, because I think, as you can imagine, we're planning for what's going to happen after June 30th. Revised budget proposal is being released right now as we speak. But the priority certainly is to extend care for essential workers beyond June 30th. So, and what the advocacy field is actually pushing for is through 2021. There's concern about, because of the changed staffing ratios and group sizes, concern about the centers being able to be able to financially be stable and stay open. We're also talking about some of the contractors and again extending some of that hold harmless that I talked about earlier about those waivers. And certainly we think there is monies that hasn't been tapped that we really want dedicated to support the field is from the CARES Act and the CCDBG funds that hadn't been released yet, and that we're really pushing for that in this coming budget. So, I should also say one other thing that I think is really significant as part of the advocacy effort is I don't know if some of you know about Parent Voices, which is a parent leadership development and advocacy, I guess you could say arm or extension of the R&Rs, but they're broader than us now, broader than just the R&Rs. But they just had their it's an annual Stand for Children Advocacy Day. We usually do that at the Capitol. It was online just last week, and they had over 6,500 looks, visits. We had 85 shares. They had over 3,000 engagements. They had over 400 comments. It was just a success, and I think they also emphasized the message of always essential, that many of the families that are on our waiting list that are seeking care and subsidy assistance, that they are, many of those are essential workers, and it has to go beyond the June 30th deadline. And so they were hugely successful in getting their message across about how this pandemic is affecting them. So with that, I am going to pass on the torch to Kim McDougall from San Diego.
Great, thank you, Linda. Can you hear me?
Yes.
Okay, wonderful. My name is Kim McDougall. I'm the Executive Director for the YMCA Child Care Resource Service in San Diego County. And we are the R&R for the County of San Diego, as well as we administer child care vouchers for the county. We have been an R&R in the county for over 40 years and have been a member of the network for that time, and are just really thankful for Linda's leadership and the leadership that the network provides to us. In San Diego County, we have over 3,400 family child care homes and 980 child care centers. So we have a fairly large provider population that has been very engaged throughout this COVID experience, I will call it. And I think, this has been a time where we have had a few really awesome silver linings in highlighting the value of childcare and the importance that childcare plays in our community. So you can go to the next slide. So upon our local stay-at-home order, which was in March 14th or so, CRS immediately pulled together a region-wide task force of over 25 community-based organizations, which have been in the past really invested in early care and education. And we pulled the group together to first make policy and practice recommendations in support of the child care field during this crazy, uncertain time. We brought together a group that was very diverse. We forged new relationships with the Hospital Association, local funders, unions representing a wide variety of workers, from the hospital workers to our childcare providers to you name it, business development groups, policymakers, local policymakers, human resource associations, our County Office of Emergency Services and Public Health, as well as police, fire, and military. These were connections that I think we had been wanting to make and trying to make over many years, and had quite a few of them, yet they have been really, really strengthened throughout this time of COVID. With this really diverse group that we brought together, we were able to really activate a lot of policy recommendations. And a lot of the things that Linda spoke of earlier that happened at the state level came from policy proposals that were put forth by San Diego County. we really were able to engage our local legislators and get them to hear our diverse voice and really kind of make some of these large statewide voices we have. We're lucky to have some influential folks right now in the legislature in San Diego. So that all really came together to influence a lot of change. Part of what this work, the group started working on at the beginning of the crisis resulted in as well is activation of a Child Care Disaster Council through the Office of Emergency Services. So our Office of Emergency Services is run by our county and was very disconnected from childcare for many years. Really, we were not part of their conversations, and it immediately became apparent that childcare needed a stronger, more official voice at the table of the Office of Emergency Services. So a formal council was created, and as part of that council, we created our countywide plan for our COVID response. This really helped open up lines of communication for us between OES and childcare, and helped formalize kind of that pathway for supply distribution and information sharing. We also were able to more recently secure a childcare seat at the Mayor's Business Recovery Roundtable. This was a group that was really just solely business focused until they came to the realization that if they were going to start reopening businesses, childcare was going to be a necessary part of that. And kind of after the fact, I think of pulling the group together, they said, oh boy, maybe we should call childcare. So we saw this as a win actually, because this has really been a time where childcare has been a shining star in our community as those that are taking care of kids who are not in school, who are, you know, necessary for reopening our economy. We recently had some really amazing recognition from our board of supervisors as well of our city, which is very Republican leaning, that that childcare is an essential service and that childcare needs to be included in a lot of these larger conversations. So part of that success has been just this last week, we were able to get the county to support us with $10 million the county supporting us in $5 million in some of their county CARES dollars to pay for child care vouchers for essential sector workers. Again, this was a huge win for us. We've never had our county put money into child care before, and we have a really Republican leaning board of supervisors. And on the day of the vote, basically they challenged the city of San Diego to also put in another $5 million for vouchers. So we went from a $5 million ask to a $10 million grant, and then another $1 million came in after to support day camp. So it was just a really amazing example, I think, of what awesome collaboration can do if you have a lot of diverse voices, and we're not just the little, childcare folks here, trying to get people's attention, but we really pulled everybody together, and it was helpful. On the ground, in support of our providers and families, this task force was really able to set up a hub model for supply distribution. We were able to coordinate resource hubs throughout the community that are already places where our providers know and love. So some of them are childcare providers themselves, some are local YMCA branches. And we, in our first round of distribution, distributed over 750 supply kits that were gone within a day. In terms of the registration for those, they were accounted, the providers snapped them up within a day. And now we're about to distribute another $4 million in supplies through this hub model that came from the state. Locally, we've also had a huge influx of philanthropic interest in childcare, and we have been able to distribute over $1.1 million in philanthropic support to families and providers to help them keep their doors open. Our providers are really telling us, as all of you have mentioned, that it's really hard to run your business in these low ratios, and that they are closing their doors and will continue to do so without some additional support. So you can go to the next slide. So as we came together as a coalition, it was really immediately clear to us that we needed to elevate the need to protect our existing childcare infrastructure rather than start setting up pop-up childcare. There was a ton of concern from the community that the childcare community that these pop-ups were going to be set up when our provider base was strong and willing to serve. And so we really decided that we were going to push as much data out as possible about the strength of our infrastructure, our childcare infrastructure, to demonstrate the need to keep that infrastructure afloat and not build something new. And so this is just a snapshot of kind of how we've done that. On a weekly basis, we've updated this data. It's real-time data that we're getting from providers with 2 different surveys a week. And we're pushing it to our Board of Supervisors. We're pushing it to our County Office of Education, as well as our local legislators. And it's been a really effective tool for us. We've done, as mentioned by Oregon, a lot of input from providers around, what are your needs, a lot of surveys, a lot of text messages, and daily updates to the field, responding to the needs that we're hearing from them. So really, using data has been key to our success. Well, if you could call this whole process success. So then the next slide, please. So then a couple other highlights from what we've done, internally at the R&R. We have moved all of our trainings online and put together virtual support groups for family childcare providers and childcare centers in multiple languages. We were hearing from providers they really needed to be able to bounce ideas off of one another and problem solve together, and these have been really successful virtual support groups for providers. We're offering twice a week. We have provided free behavior consultation because early childhood mental health consultation has really been coming up as something that providers need support with, and so we've made that available free. For providers, we have really been focusing as well on our staff and how we support our R&R staff during this time where we're all working remotely, and have offered a ton of virtual staff support groups. We utilize the Strengthening Families approach very heavily, and so we've been focusing on protective factors and how we help strengthen protective factors in not only our staff but our providers. And then lastly, we have been working really hard to provide enhanced referrals for providers, and have provided over 1,000 enhanced referrals, which essentially means we are calling providers on behalf of families to help identify slots that are open and meet the needs of our essential service workers to really try and streamline the process for them. And this has been a very successful way for us to not only support our existing childcare infrastructure, but make it easier on families and highlight the value of the R&R as a hand-holding experience that really helps parents understand the importance of quality care and the choice that they're making. So that's kind of what I wanted to share. I would just again highlight that this has really been a time for childcare to shine, and I think, as difficult as it's been, we really have an opportunity now, at least in San Diego, to keep childcare front and center, get a policy platform put together for our county, and take advantage of this moment in time. So thank you.
Thank you, Kim, Linda, Robin, and Joan. Mindy, I'm just going to ask if we have any questions. I know we don't have a ton of time for questions, but we'll make time for a few.
Yes, hello everyone. One of the questions that we're getting in that I think both states could answer is there any hazard pay being included for childcare providers in either of your states?
This is Joan from Oregon. I can say that it is not being included at this time.
Same here with California. It is certainly a big conversation that has arisen.
Great, thanks guys. I know that had been asked several times, and we're hearing that here at Child Care Aware of America, and I know states all over the country are grappling with that very question, and how can that be handled? So thank you for sharing that. Here's one for Linda. It's from a family home child care provider, and she wants to know, in California, what types of supports are being offered for the family child care home providers?
I guess there's numerous things. One is certainly the supplies is one of the aspects that all R&Rs across California are supporting folks with. I think there's also conversations about making sure that folks know when you are open. And so that is making sure that you're in contact with your local R&R so that they know if you are able to take children, and also sure that you understand all the new guidance on that. And so really using the R&R as your communication with licensing if you're not getting direct information from them. Other supports are around some of the professional development or some of the curricula or activities. There are a lot of things that various R&Rs are offering. So really looking at your local R&R as just sort of that resource for you. I think as Kim described in her own county, just the number of things that they've done to support. And San Diego, I must say, is way over the top in terms of other things, like on some of the scholarships and other kinds of support to maintain their business as you know, during this hardship time. And so things like that, I think the R&Rs are working at different levels to find different resources for you.
Great. Thanks, Linda. I'll pause just for a second. I'm seeing several questions come in wanting to know about what other states are doing and where you can access grants for your state. I want to encourage you to visit our website at childcareaware.org. On there, you'll see that we have lots of resources that you can use within your state. There's also a state-by-state map on there where you can click on your state and see the information that we know about your state. And there is a recording of all the previous webinars that we have done. We're trying to do as many states as possible in this series. Lots of requests have come in about different states, so we're taking that into consideration as well. So please keep following our website for that. And then this is a question for Oregon. They wanted to know if all parents' copays are waived or just clients who lost employment or have decreased hours due to COVID-19.
All parent copays are waived right now.
Great. And then another question, I believe this is for Oregon as well, and it says, who decides how much grant money will be given to each child care provider? How is that determined?
It was based on the size of the child care facility. So different licensing, regulatory sizes, and also then subsidized unlicensed childcare that serve 3 or fewer children are also eligible. So it's a tiered amount of money, and it was communicated as a part of the request for proposals that closed on Monday.
Great, thanks so much. And then this question is for Kim at the Y. They want to know if there's a way they can access the advocacy tool that you spoke about. Is it online? Where can they find that at, Kim?
So all of our policy platform documentation and that kind of thing are on our YMCA website. So you can just go to ymca.org, and I believe we still have that URL. We might change to ymcasd.org actually recently. And you'll find all of the information we've put out to providers and the blog posts that we have been creating, as well as the policy and advocacy tools. Or you can also email me if you have specific questions at kmcdougal.org, and I'm happy to share.
Thanks, Kim. Thanks, Mindy. So we are right at the end of our time, and I wanted to thank Joan and Robin, Linda and Kim, and all of you for joining us today. I know that there are a lot of questions, as Mindy said, regarding states, and I just wanted to direct you all. It was posted in the chat, but if you have specific technical assistance needs, please check out our new emergency child care and technical assistance center at childcareware.org. Emergency Child Care Technical Assistance Center is the link that's also in the chat. We are going to be hosting another webinar series next week, part 5. We invite you to join us. As you know, this series highlights certain states to help all states learn from what is happening across the country. So though we may not be able to tackle your specific state during this series, just know that this gives you ideas to ask in your state and find additional information on our website as well related to what your state might be doing. So again, we thank you for joining us, and we want you to have a wonderful rest of the day.
Thanks, everyone.